Hello, everyone. Welcome back. This is another episode of Let's Keep Moving with the APDA. My name is Teresa, and our topic for today is tips for optimizing posture for people with Parkinson. And that's what I'd like to share with you today. That's coming from questions we get a lot with patients that we work with and people who have seen this program. I think this is something that's on everyone's mind. So by way of introduction, I work with a team of physical therapists and researchers at Boston University. This is the team here that some of you may have seen from our earlier broadcasts. And we are dedicated to optimizing rehabilitation for people with Parkinson. This is our contact information at BU, and for anyone that would love to get in touch with us, we would love that. Just by way of very general kind of information, as before we get started, this is an important reminder. Some of you who have joined us in the past, you know that we present these webinars as general information and not individual advice. So we want to make sure you please do consult your individual physical therapist or physician for recommendations that are right for you. Okay. So when it comes to posture for people with Parkinson's, I have a kind of a general question for everyone in the audience today. I'm curious what you notice about your posture and how has posture been affecting you? So I'll leave that kind of as an open question. But when it comes to posture for people with Parkinson, again, not everyone will have every kind of presentation that we're mentioning today. But what can be typical is to notice this kind of a posture, as you see here, kind of that more forward head, rounded shoulders, a forward trunk lean, and perhaps a bend in the hips and the knees. And again, this is often what we think of. And the reason that we are concerned, or we're kind of talking about this today, is that this kind of a posture, especially when it's sustained, can lead to difficulty with moving parts of the body, more specifically, neck, the trunk, the back, and sometimes those parts of the body are painful. This kind of a posture can make it difficult for everyday movements, say standing up to get out of a chair, reaching above. Um, this kind of posture makes it a little more difficult for balance because you can kind of see the figure here. The posture is kind of positioning the center of the mass of the body a little more forward over the feet that provide the base of support. So when the center of the mass is a little more forward, it makes it harder to balance. It makes it a little more easier to lose balance in the forward direction, and it makes it a little more a little more difficult rather, to react to balance challenges and coming at different directions. And then for this kind of a posture, if it's sustained for a longer period of time, the body kind of loses a perception of where it is in space. And this kind of forward position starts to feel more natural, and it starts to feel more cumbersome to come up to more tall posture. With this kind of posture, we also notice that sometimes it can feel more challenging if there's another activity going on, not to kind of sink forward into this position. And then some other sort of practical considerations is it's more difficult to maintain eye contact in this with this type of a posture. It can feel more difficult to get a full lung volume and take deep breaths. Can also lead to difficulty with communicating if the lungs feel like they can't kind of inflate as much as they would typically do. Can also lead to maybe difficulty with tasks such as eating and swallowing. So there are kind of a number of different concerns about this type of posture and kind of the consequences of what it could lead to. And so kind of brings up a bigger question of, well, why? What is going on with this type of posture that it is so typical, or can be very typical for people with Parkinson? So, by way of very kind of general explanation, what's believed to be happening is that the basal ganglia part of the brain for people with Parkinson that has less dopamine is kind of influencing the pathways that run from the basal ganglia through the brainstem down towards the spinal cord. These kind of descending pathways are responsible for the automatic processes that are involved in maintaining posture, and also involved in the processes that drive kind of the muscles that would react and keep maintaining an upright posture. When these pathways are impaired, the brain receives less accurate information about where the body is in space. That makes it harder to keep an upright posture. And these pathways that kind of drive down from the basal ganglia, the brainstem, through the spinal cord, they're responsible to the drive of the muscles that help keep the body in an upright resting state. So when their pathways are a little more interrupted, you don't have that same kind of drive to maintain that posture. And so it becomes a little more easy to kind of sink forward, almost like sinking forward with gravity. One analogy that sometimes we'll talk through with people is that these kind of nerve pathways are almost like a kind of like a cruise control or maybe an autopilot for posture. And so when the pathways get interrupted, the postural muscles that are more typically on autopilot aren't as automatic anymore. So you have to think about it more. And people with Parkinson can certainly get into a more upright posture, but it takes more cognitive attention, and it's just not quite as automatic as it might be for other people. And so again, what that is kind of bringing us to is um, again, this is just looking at you can see the picture of the back of the body, the muscles of the back of the body. Those are often referred to as extensor muscles, is muscles that kind of open up a joint. So these muscles have the effect of extending, and you can see the diagram on the side here. The extension in the back is that position of being tall or even being a little more arched backward. And the extensor muscles, there's a number of them in the trunk and the back. The glute muscles help extend the hip. The quadricep muscles extend the knee. The calf has an extension motion at the ankle. So these muscles are the ones that are the most affected by those nerve pathways being more interrupted. And so with the muscles that are helping extend, having less almost excitation, it's easier for the body to kind of be more forward in that position. And so it kind of leads us to a question about, well, in that case, what would we want to do about it, and what can people work on or work together with to help these postural changes? And again, kind of going towards knowing where some of the changes are coming from, the neural pathways, we also recognize that these postural changes are occurring or can occur slowly over time. Again, it's that decreased automatic sense of upright posture. And being in this kind of forward position for longer periods of time can also contribute to tightness or stiffness, which are also features of Parkinson's in general, where muscles are moving slower and maybe feeling more rigid. So these are things that are can work together to kind of contribute to this forward position. And so it can be quite a concern for people. And I think if maybe we could kind of think of maybe addressing these in a variety of different ways. Um, and so one way to address some of these postural changes is using exercise as a means to support posture. And one one way that's often quite important is working on stretching to kind of control or facilitate the amount of flexibility in the muscles, in the joints, and in the soft tissues. And again, posture for people with Parkinson is not only a flexibility issue, it's not only a strength issue, but these are avenues that can contribute to kind of that forward position as being almost the default. So it's important that the muscles of the body that have the tendency to be in the more shortened position, especially the muscles of the front of the chest, the front of the shoulder, the front of the hips, it's important that those muscles maintain the length that the muscles need, and then the tissues around the muscles maintain their ability to get into a tall, upright position. So these are just some examples of stretching movements at again, the chest, the hip, the back, that help create sort of the ability to maintain and achieve these kind of open positions. Um, so stretching flexibility is one avenue um, to kind of help address posture. Another avenue is strengthening. So we want to ensure, again, this is not posture concerns for people with Parkinson is not only a strength issue, but we want to make sure that the muscles are able to perform their jobs and to kind of help maintain that tall, upright postural position, and that they're able to kind of engage in the movements that people want to be able to do. So often strengthening is targeted at those extensor muscles that have that reduced neural drive. So strengthening through the muscles of the back, the mid back, the upper back, lower back, strengthening through the muscles of the glutes, the back of the hip, back of the calf, the quads. These are just some examples of muscles that really um, that it's necessary to kind of keep up with a strengthening program to be able to have the strength needed to achieve that posture position and to be able to take advantage for all the positions that people want to be able to get into. And so an individual stretching program, an individualized strengthening program can be quite helpful. Another thing that can be helpful in this front is some exercise classes or community-based exercise programs that often have a component of posture or a component of positioning as part of it. These are just some examples, but Tai Chi, yoga, certain dance styles really work on the position of the body, especially the position of the head and the trunk. And sometimes it becomes a kind of a more enjoyable way to work on creating these postures, doing it in the context of a class, especially a class that someone enjoys. So the idea of flexibility, strengthening, potentially some of these other multifaceted classes as a means of kind of being able to create postures and maybe sustain and work on postures that are more upright and working against sort of that rounded forward position. That's one way to kind of keep up with that kind of postural assist. There's other types of strategies to uh, that are can be utilized to optimize posture. Because again, for some of these postural positions, it's the automatic drive for upright posture that's not as sustained as it once was. And so it's very difficult to think about posture and think about this upright position at all points in the day. And so one avenue of ideas involves kind of being able to change postures to stay out of very prolonged positions. And so I don't know if anyone can relate to, say, some of the pictures here where someone's reading or someone's at their computer and almost without realizing it is in kind of a forward rounded position. And it can be for, you know, for half an hour at a time, just because we're preoccupied with what's going on at the computer or whatnot. So some of these strategies are important using as the idea of trying to stay out of prolonged positions for longer amounts of time, especially positions that kind of feed into that forward rounded position. So some ideas in this kind of category are to take movement breaks throughout the day and to almost have a postural check in with yourself throughout the day. Sometimes things that work well for people are using visual cues. So sometimes people have put little signs on above their computer. People know that they're trying to align themselves with, say, the top edge of the computer screen or what have you. And then to stay out of these kind of positions that involve a lot of sitting and a lot of forward positioning throughout the day. Those are some ideas to kind of manage sort of staying out of these prolonged positions. Other ideas include reminders or postural check-ins through the day. So I am curious for people in the audience, especially people who have Parkinson themselves, how do you like to receive reminders about your posture, if you do? And I'm very curious with what kind of strategies have worked well for you. In some cases, we recognize this can be a frustration point when people in the family or other care partners can see someone with Parkinson being in a more forward rounded position. And we've heard from some of the people that we work with or some of their families saying that, I've told him to sit up straight, or I mentioned to her that she's kind of forward, and having a hard time kind of maintaining that upright alignment, despite the fact of getting cues or reminders from family and friends. On the other hand, I've had some people who work for whom that kind of reminders have worked very well, and there's almost like a schedule of reminders within the family or within the friend group. So I'm very curious to hear from people in the audience what has worked well for them. Another idea, this is going off of the kind of the similar idea of having a cue or a reminder visually. You can see here there's a picture of someone almost looking at a mirror-based reflection, because again, the person who's having this kind of forward rounded posture doesn't always realize that they are. And once you can see that reflection in the mirror, you can almost take that as feedback to kind of make an adjustment and come up to a taller, more aligned position. Sometimes we'll ask people throughout the day to use almost tactile feedback. So that sense of touch, you could see someone here has their back against the wall. That's kind of the feeling that the body can kind of incorporate of what vertical is, up, tall, vertical. And again, it gives the body a chance to kind of align to that surface. So these are some other ideas to be able to incorporate throughout the day about reminders, either maybe verbally hearing it from someone in the family, visually, something you could see like a mirror, or maybe tactile, something that you can feel. Excuse me. So also want to discuss potential for other technology to be able to support posture. And again, as with everything, there would always have the tendency to be some pros and maybe some cons to whatever kind of technology or whatever device is being discussed. Here, what you see are ideas for technology based on assistive devices. This is maybe more relevant for posture with walking. So you can see here is two different hiking poles. Sometimes people will use this as a cue or maybe even as a little bit of a balance check-in, but more relative to posture with walking. And you can see the picture of the person using that hiking poles there. The hiking poles have a tendency to have a higher grip point, so that almost gives a little bit of ability to use kind of the arm and the pole itself to kind of achieve a taller body position. This on the right-hand side is an example of a style of walker called an upright walker. And the difference there is that the armrests and the handles are a little higher. So the arms themselves would rest, the forearm would rest in kind of the cradle there. And that would help keep the torso a little bit taller based on kind of the feedback and the support of that kind of device. And again, this is a kind of thing that may not be right for everyone, but these are some ideas of using assistive devices as means to support posture. Um, Other technology, and again, I mentioned some of these because they're out there as devices or potentially on the market, but I just want to acknowledge that these are uh, perhaps not specific for people with Parkinson. They may not be as well studied, but just to give some idea of using other technology, that could include something like setting a watch or setting a phone with just reminders of kind of checking in for your posture, the way that sometimes people will use a phone reminder when it's time to take medication. Sometimes people consider setting an alarm to give themselves sort of that sound, and then to recognize it's time to check in on what you're how you're sitting or what your alignment is like. There are also other devices that sometimes would be called postural correctors. Sometimes these are wearable garments, and some almost have an almost look like almost like a suspender with kind of attachments through the trunk and the back, almost to give a little sense of a pulling or feedback to kind of help give that sense of kind of tall position. There's other style of devices that are actually sensors worn on the body that give a little bit of vibrational feedback when the posture is sort of out of what the tolerance is considered. Um, there's other style of devices that may be more typical for people to have in, say, even just their desk chair. The idea of kind of a lumbar support to kind of support the natural curves of the spine or cervical support at the neck. So these are just other ideas of different devices or pieces of technology that could be used to kind of support an upright posture. When it comes to concern with posture, if that's something that somebody is concerned about or someone in the family is concerned about, really the one of the best things to do is to seek an individual physical therapy evaluation, and because that's something that physical therapists can work with a person to kind of identify what areas of posture are, say, the most challenging for you, and then also what areas might be the most helpful to address. Again, if it's the kind of thing where an individualized stretching or strengthening program is appropriate, physical therapists can help design that. If it's the kind of thing where trying to understand what cueing strategy might work well for you and to try different things, that's a perfect opportunity for a physical therapist to provide support. And I feel this is sometimes a message that we often want to share, but really one of the best times to seek a therapy evaluation is very early on, maybe even before you notice posture is a big concern. And certainly anytime that something is changing or there's concern, this is definitely an area physical therapists want to help. Um, so, kind of in a very brief summary, posture can be a concern in a number of different areas for people with Parkinson. The tendency is to have that kind of rounded forward posture, but that can also lead to a number of other challenges. And these changes can be occurring slowly over time. It is important to have kind of a daily practice for someone to be able to incorporate some of the elements that we've talked about into their daily routine to help address um, postural concerns. There might be a role for technology or for other cueing strategies to help with keeping an eye on posture, because we recognize it's exhausting to have to think about that all the time. And then for anyone that's having concern or anyone in the family that has concern, this is definitely something a physical therapist would want to take a look at and hopefully provide a very individualized plan to help address. Um, and on that note, um, our office partners with the APDA. We provide an exercise helpline, which is a toll-free line, or our email address is rehab@bu.edu. These are the kind of things that we would be very happy to try to address with someone. But what we're even more sort of effective at is to try to recommend physical therapists in your particular area who might be able to help you addressing kind of your individual needs, beginning with the evaluation for posture. So I know that was kind of a lot to cover all at once, and we'd be very happy to take your questions. For that, we'd like to bring on our colleague, Tim Nordahl, to kind of help manage the questions that have come up from today and to talk about this a little further. Hi, Tim.
Hello, Teresa. Thank you so much. That was really just a fascinating listen, and I see a bunch of questions coming in. So bunch of really great questions. And if you haven't sent any in yet, feel free to write in to us. We'll be trying to monitor the Q&A and get to as many as we possibly can. Um, I wanted to lead off with one, Teresa. So this participant wrote, I keep telling my spouse, so it sounds like their spouse is the person with Parkinson's. I keep telling my spouse to stand up straight, but that doesn't really work. Is there any other way to suggest that?
Thank you, Tim, and thank you to the person who commented on that. I feel that that is an extremely common sentiment for care partners, and then for people themselves with Parkinson have mentioned to us that that's also something they've heard quite a bit from their friends or family or children or what have you. And I think maybe one thing to recognize is that these postural changes are are not something someone is doing on purpose. Again, because of the decreased neural drive to some of these postural muscles, person with Parkinson may not really be realizing how forward they are, and after a while being in that position doesn't feel abnormal. It starts to feel like that's actually kind of a typical posture. So my first suggestion there would be to think of other cues that the person themselves might be able to take advantage of. Again, sometimes seeing the posture, so having, maybe a mirror that's also in the office, or if there's a mirror at some certain part of the house, or even knowing that if the person can kind of see something that they know is kind of a more up tall, or something in their line of sight, like say the edge of a window or partially where the drapes are in the dining room, if they know that's kind of in a tall position, almost asking them to line themselves up with something that is kind of in a taller position. Sometimes using those type of cues versus the frustration of one person saying stand up straight and the other person having trouble with it. Sometimes those are a little easier to manage, or gives the person a greater chance to kind of self-adjust their posture.
Yeah, I think this question is great too, because it does lead to a little bit of friction, right, with sometimes between the care partners and people with Parkinson's. So it's almost important to talk about sort of like how often to get those reminders and how to structure them, right? And I hope, like, I really appreciated your point about the autopilot, and how that's broken, because it helps like us people who don't have Parkinson's to sort of understand a little bit about what's going on, and why it's hard to maintain the right posture. You can make the correction, but it's harder to maintain it, right?
Yeah, yeah, yeah.
Um, and on that note, I think another question that we had gotten was about if anyone had any suggestions for a specific app. So Alistair had asked, does anyone know of an app that can be installed on your phone to give regular, discrete reminders to check posture, get up and move, those sorts of things?
Yeah. So I appreciate that question. Thank you so much, Alistair. And again, I know on these broadcasts, we are certainly not trying to advertise any product over another product. I, I, I don't have a specific app to mention. I will say some of the postural correctors, that's maybe that general term out there, that I have just seen. Again, these are not necessarily specific for people with Parkinson, but some of the devices that can be kind of worn on the body, some of them are almost like in maybe a reverse neck necklace style where the
Yeah.
sensor itself is on the upper back. So I know there's some devices where the sensor itself is attached to the body and it kind of partners with an app that is accompanied with that device system. And so when the sensor senses that the body is sort of out of the tolerance of what's considered sort of the optimal posture, it kind of does send. Sometimes will give a vibration right against the skin, or sometimes kind of sends a signal to the app, which that in and of itself gives a reminder. So that the app based sort of controllers often have a body worn sensor, something to be the signal that it's time to make an adjustment or that the body's position has fallen outside of what's considered optimal. But I'd be very curious if there's anyone in the chat who has themselves used an app that they have found to be helpful in terms of managing posture.
Yeah, and I see Pete Briss had written in that even just kind of using the regular old, it looks like the calendar app or like the reminders you get
Mhm.
on your iPhone to get up and move around, just
Yeah.
something to kind of reposition and kind of remind yourself. Maybe you can work in standing fully upright and working on that correction up against the wall or in a standing position with a visual target, like you mentioned. Maybe we can work that into these kind of reminders that you've got on all the kind of standard calendar apps that come on your phone. So that was a really great suggestion that I had seen in the chat too. Um, Another one that was interesting was I find that my body leans to the right when I stand. I know we talked a lot about like kind of the forward posture, and that's another thing that can happen sometimes. But I don't know if there's kind of like a way we could talk about how some of the suggestions we have might help with that sort of pattern as well.
Yeah, absolutely. And I appreciate that question. And again, that can also be very typical that there's maybe a one-sided direction that's a little more um, typical for posture to align with. Again, I would want to ensure that the torso itself has the flexibility to kind of keep that upright, tall position. Because if there's a tendency to be to one side, there's a tendency for one side of the torso to be a little tighter, perhaps the other side to be a little more elongated. So the idea that the torso and the front, the back is flexible in all directions, strong in all directions. I think that's also an important point. I think also again comes back to maybe a visual reminder. Sounds like this person is quite aware that they end up towards one side, but not everybody is. So sometimes the idea of almost seeing yourself in the mirror to kind of try to align to sort of as neutral of a position as you can, and then almost feel what that feels like to be able to stay there. So the idea, I know this is kind of a theme throughout the day, that posture and maintaining good posture is multifaceted. But the idea that there's enough flexibility to kind of keep a tall position, and that there's enough strength to sustain it, and then the idea that there's something from the outside that kind of gives the person the idea that they are maybe a little more tilted to one side.
Yeah, yeah, and
Yeah.
that's a good point, Teresa, because a couple of other people had asked about kind of like stiffness or even pain when trying to fully correct their posture.
Yeah.
So I saw like Christine had mentioned that, and Michelle had mentioned that too. So maybe we could talk back about. I know when you mention exercises that can help to support that posture, how you might want to see a PT for those kind of problems before you really focus on the perfect posture.
Tim, absolutely. Because as we know, everyone's going to be slightly different in terms of what areas are stiff, what areas are sore. Sometimes people feel like they really don't have that same amount of rotation throughout their torso, so they might find that all the movement is kind of almost turning like a block. Meaning that it's just difficult to turn a little, subtly. So I definitely agree. I think this is an area physical therapists would very much want to work with the individual to try to figure out what's the right kind of approach for you.
And I think we might have time for like one or two more questions. But one I had seen that I think I wanted to bring up, because I know you mentioned how we could consider an assistive device as sort of technology to help support upright posture. But Maureen asked, I use a walker and find that I tend to lean forward while using it. So I didn't know if you wanted to comment on that.
Absolutely. And again, for some people, the position of the body to the walker is something that we work on quite a bit so that the walker doesn't have a tendency to get too far ahead, which is another thing that kind of almost enforces that forward position.
Right, right.
And sometimes different styles of walker may feel like they almost zip away. Some are very mobile. So sometimes considering maybe a slightly different version of a walker. There's one out there for whom it's you have to unlock it almost to push it, so it gives a pretty good amount of support and it doesn't tend to get as far away. Sometimes, to be honest with you, the adjustment of the height of the walker matters quite a bit. Sometimes people bias the walker up a little bit for the point of trying to create more of a tall trunk position. Now, again, that's kind of a personalized recommendation. So I think that's an excellent opportunity for a physical therapist to give their opinion or to trial different things with someone about what's maybe the right style walker, or could there be a different way to use the walker so that it doesn't get too far forward or the person feel like they have to be forward to use it.
Mm-hmm.
Yeah.
Yeah, thank you. Yeah, that's was first thing I was wondering about too, is if like a different style of walker or an adjustment to the settings of it might be able to help.
Yeah. Yeah. Yeah.
So I
Yeah.
think our last one, I wanted to just highlight one more comment that David mentioned. So he said he does a lot of Zoom meetings each week, and he uses the image on the computer to try to help him make his posture correct.
What a
And
great
yeah,
idea. Dude, thank you for that. That I feel like almost everyone on Zoom could take your tip. That's excellent. Yeah, I
yeah. So
appreciate
finding like
that.
these little reminders in
Yeah,
your day to day to help with that
yeah.
autopilot problem, right?
Yeah. Oh, well, Tim, thank you so much for managing all the questions, and thank you so much to everyone. And again, I just want to highlight that this topic came to us from sort of the people in our audience who were bringing this to our attention, that this is something that they would like discuss. So, for anyone that's here in the chat, if there are other topics of interest to you, please let us know. And I know there'll be more opportunities with the emails that come out relative to the reminders for this program, because we really want this program to be for everybody. So with that, I just want to thank everyone today, especially the APDA, for providing this broadcast and also for partnering with us for this program in general. So we really appreciate it, and we hope to see you the next time on the next Let's Keep Moving. Thank you so much.
Hi, I'm Leslie Chambers, President and CEO of the American Parkinson Disease Association. Thank you so much for joining us today on our program. Every day, APDA is committed to providing helpful programs just like this one, as well as a wide variety of support groups, exercise classes, and educational programs to support the Parkinson's disease community. Whether online or in person, APDA is here for you every step of the way. You can find all of our upcoming virtual events on our website at apdaparkinson.org/events. We keep you posted on our social media channels as well, so make sure you follow us there. You can also connect to local resources and events through our nationwide network of chapters and information and referral centers. Remember, we're just a click or a phone call away. If you've enjoyed today's broadcast, I hope you will consider making a donation to help keep programs like this possible. Every gift, large or small, helps APDA support people living with PD through thoughtful programming, reliable resources, groundbreaking research, and more. Please visit apdaparkinson.org/donate today to support our critical work for those with Parkinson's. We are so grateful for your generosity. Thank you.